Let's talk about scan bodies and what they are. Scan bodies actually are the equivalent of transfers, and these transfers, as you can remember, were used in analog impressions to take the information to the stone model, the information of the implant placement, and inside them, the analog is screwed in and the model is poured. Scan bodies are actually composed of two parts. One is the physical object, and the other is the library of this scan body. And how they work. After imaging the patient, the scan body is seated, and new impression is done, digital impression is done, that contains the relationship of this scan body and the scan body itself to the mouth of the patient, teeth, gingiva, and after this mesh is done, the computer will then be able to take from the library the perfect structure, the perfect surface of the scan body, and will match it with what we scanned. Of course, what we scan is never perfect, and the scan body there is going to have data that is sometimes bigger and sometimes smaller than the actual physical object that we scanned. But the computer is able to take the perfect dimension of the scan body and try to place it inside our scanned mesh as closely as possible. So actually it's triangulating this library inside our mesh. After we do a good impression of the scan body and the computer starts matching this new library to the mesh, we're going to get a heat map, and this heat map will tell us how precise our scan was. Ideally, we should stay under 20 microns of precision. As you can see on your left, although we have blue lines on the scan body, and this in ExoCAD means 20 or under 20 microns, the rest of the structure is green with yellow spots. So for me, at this point, I would say such a scan is good but not good enough. So we're going to have quality of meshes like the one in the middle, that is a Medit scan, and you see that the scan body on the heat map for Medit is green with some blue and yellow spots, but mostly green. This means it's very precise. The same scan body from the same patient you see in ExoCAD on your right, and then you'll see that this scan body is mostly blue. So this is an acceptable impression, and this will give a correct position of the implant that the patient has inside the bone. What is a library? So the library contains the perfect dimensions of the scan body, and correlated to this scan body, we have a virtual implant and the implant's hex and various other connections that will be used for the final work, like hybrids or direct to implant connections or multi-unit connections that are going to be contained in the final prosthetic work that we do. So the scan body will actually transmit to the lab what the position of the implant is as far as where it starts, what angulation it has, how the hex is placed or any other connection structure is placed inside it. So every information needed to build the final work is already contained in this library. So once the library, the scan body from the library replaces the scan body we scanned in the digital impression, now the computer will be able, because of this library, to replace parts and now build upon a structure as the right image shows. In the right image, you see an implant and the hybrid that it uses. So now the computer knows where to place this hybrid and build the crown upon this hybrid that we are going to cement inside to do a screw retain crown. This is Also, the way to do custom abutments or bars or anything else that you need doing from a digital scan. Scan bodies have 2 or 3 components. Every one of them has the connection. The connection needs to be seated inside the implant, and this is the first thing I have to tell you about connections is you have to place and check that the connection is correctly seated, that it doesn't move. If you have a hex or a tri-lobe or anything else, you have to check that the scan body is not rotating. You have to torque the scan body to the correct measurements, and afterwards, after you are convinced that you can do an RX to verify placement of this set scan body is correct. And afterwards, you're going to take the digital impression. Digital impression will actually do a mesh of the upper part of the implant, that it is comprised of a middle section for some implants and the scannable section. For other brands, the whole upper part is composed of the scannable section, as you see in the image on the left. The library not always contains the whole scan body, so sometimes it only contains the upper part, or in other cases only the flat part. So it would be wise to know what library you are using, because that is the part of the scan body that you have to have a perfect scan of. If you don't, just try to impression the whole of the scan body as correct, as precise as possible. Scan body materials. On the left, you see a scan body that is done out of PEEK. This is a soft material, very easy to scan, but it has the disadvantage that being soft, it's going to be prone to deformation when you sit it inside the implant, also prone to deformation after multiple cycles of sterilization. So this is why mostly PEEK and soft material scan bodies are good for mostly a single impression, and then you'll have to change it. In the middle, you'll see a scan body done out of metal and coated with PEEK or any other material that is a plastic or plastic-like, so it can easily be scanned. And on the right, you'll see metallic scan bodies. The middle one that is coated is very easily seated and torqued, and also is very easily scannable, but it has the disadvantage that after some time, it's going to chip, and the metal underneath is going to show up, that is a very shiny metal, and it's going to get things harder to scan. So when this happens, my recommendation would be to replace these scan bodies. The ones on the right, the metal ones, are the least prone to be modified over time, but they are also very hard to scan because they are very shiny. So some of us are trying to image them after they are being sprayed, but that induces volumetric modifications of the scan bodies, so it's not the correct technique to use them. This is why in metal scan bodies, I prefer the ones that are sandblasted, and this giving the perfect results on all components of the scan body. The structure will remain the same even after longer sterilization cycles. They are very easily scannable, and the results are very good. So one of my recommendations would be try to find such metal scan bodies that are sandblasted.